Borderline personality disorder is often explained in two oversimplified ways. Either it's all trauma or it's just someone's personality. Both explanations miss the reality. BPD is not a moral failure, and it is not a hopeless diagnosis. It is a treatable pattern of emotional pain, relationship sensitivity, impulsivity, and identity confusion. If you or someone you love is struggling, the immediate first step is stabilizing that floor. This means securing sleep, physical safety, and building a therapy structure that teaches skills during emotional storms. In a few moments, I will share the exact shift that separates patients who stay stuck from those who finally recover. I'm Dr. David Danish, a double board certified psychiatrist, and the surprising reframe is this: BPD is not one single thing. In my clinic, the nuance people miss is that two people can both meet criteria for BPD, but have entirely different biological and environmental drivers underneath. For one person, the main driver may be trauma, dissociation, and attachment injury. Dissociation means feeling disconnected from your body, your emotions, and your surroundings. For someone else, the driver might be lifelong emotional intensity and overlap with ADHD, and severe rejection sensitivity as a result. The biology matters heavily here. The nervous system in BPD often reacts rapidly to social threat. The brain regions involved in raw emotion activate quickly, while the regions responsible for slowing down and reflecting simply do not come online fast enough. The environment matters a lot too. Now, you might be wondering if BPD is purely genetic or purely trauma or purely environment. It is usually a mixture of emotional temperament and repeated invalidation. Invalidation happens when a person's emotional experience is dismissed or mocked so often that they stop trusting their internal signals. Over time, the brain learns that extreme emotional escalation, like self-harm, is the only way to be heard. Therefore, the best treatment asks what factors are keeping this person stuck right now and how we can target them safely. Dialectical Behavioral Therapy, or DBT, has the strongest evidence for reducing self-harm and emotional dysregulation, which is the difficulty in managing those intense emotions. While we navigate biological options, remember, there is no FDA-approved medication that treats BPD as a whole. We might use medications to stabilize the floor by treating sleep or severe mood reactivity, impulsivity, but chasing every crisis with a new pill pulls us away from the real goal. To help you explore these and many other treatment options for BPD safely, I placed a free guide in my Mind Vault at drdaviddanish.com, and that link is in the description. Now, the shift I had promised earlier. Recovery begins when BPD is treated as a pattern to understand rather than a character flaw to condemn. The goal is never to erase emotion. The goal is to make emotion safer, slower, and less destructive. By combining the right structure, boundaries, and carefully chosen biological support, you are not just surviving emotional storms. You are building the capacity to navigate your life with clarity, connection, and a renewed sense of agency.